Hi, welcome to Ask Dr. Tan. This is a new series where we take the questions that you guys ask us on our social media, and every week we'll deal with a different topic and try to answer your questions as best we can. So this week is a very interesting topic. It is about e-cigarettes. Now, before I get into that, let me remind everybody that the distribution, possession, and use of e-cigarettes in Singapore is illegal. Okay, so we're not in any way trying to promote the use of e-cigarettes. But let's look at some of the interesting questions that we got on our social media platforms. So the first question is, are e-cigarettes better than normal cigarettes? Okay, now before I answer this question, I want to say that cigarettes and e-cigarettes are both harmful to your body, right? Ideally, none of us should be using any of these products at all. Right? But if you want to compare a combustible cigarette versus an e-cigarette and the data that's available, the FDA have done an independent study, as well as the European Respiratory Society, as well as WHO, and they all concluded that users of e-cigarettes are exposed to up to 99% less harmful and potentially harmful chemicals compared to a combustible cigarette. Right? So that's a fact. Now, the question to be asked next is, does this then lead to better health outcomes? Unfortunately, we don't really know that yet. So there are certain small-scale studies that have come out to show that people who suffer from chronic bronchitis who switch to e-cigarettes completely get an improvement in symptoms. Studies to show that people with gum disease who used to smoke and switch to e-cigarettes completely have improvement in symptoms. So we are eagerly awaiting bigger, longer-term studies on bigger diseases like cancer, like heart disease, like strokes, to see if people who used to smoke but completely switch to e-cigarettes actually have a better health outcome or not. All right. So the second question is, are light cigarettes the healthier choice? Okay, no. All right, light cigarettes was a big marketing scam by big tobacco companies way back when. So because they knew that there were all these studies coming out showing that cigarettes were leading to a high risk of cancer and strokes and heart disease, they came out with this huge marketing scam by telling people that, oh, these cigarettes are lighter, lower tar, and therefore better for you. And all that is unfortunately BS. It has all been disproven. In fact, there were a lot of these secret communications between top executives in tobacco companies to show that they themselves knew there was a marketing scam, that light cigarettes were in no way healthier, but yet they were still pushing it to the public. Right? So honestly, these days, there's a lot of policy and laws in place to prevent cigarette companies from using things like light or healthier to try to push different cigarette products. Cigarettes are just harmful, flat. And the third question is, I'm always falling sick each time I try to quit. Is there a medication to help me quit easier? Oh, this is interesting. So whenever a person tries to quit, they usually would get withdrawal symptoms because of nicotine withdrawal. Now, obviously, how bad the symptoms are depends on the individual. It depends on how heavy a smoker he or she was. Because the brain actually likes nicotine. It activates our reward systems. So when you suddenly take that away, the brain is starved of these chemicals, and you can honestly feel extremely lousy. Also, as your lungs are trying to clear itself out from all that tar and all that nonsense chemicals that you've been sucking into your lungs all those years, you might get a lot of respiratory symptoms like shortness of breath and coughing and phlegm. Think of it as a process that your body has to go through to detox itself, and that might give you a more positive mindset to get through this. That said, there are a lot of medications, including nicotine replacement therapy, that doctors have prescribed to you to try to take the itch of these withdrawal symptoms, really just to help you stay off those cigarettes and remain smoke-free for the rest of your life. So yes, there are medications to help you. You should see a doctor that is learned in smoking cessation and speak to you about your options. All right, I think that wraps it up for this week. I'll see you next week for the next topic.